So my name's Tammy Dangerfield. I usually go by Tammy, and I am a physical therapist, as I said, at the Pain Management Center, which is just kind of right down the street from the neuro clinic and the headache clinic. So we treat all kinds of chronic pain, and it's an interdisciplinary clinic, so we treat all varieties of chronic pain, but we approach it from an interdisciplinary model. So we have physicians and physical therapists and psychologists and a nutritionist all on staff, and pretty much everybody that comes to us gets evaluated by all three team members. And then we all kind of sit down and talk about what types of therapies will be most helpful for this person and in what order and all those kinds of things. So quite well versed in the medical side of things, the psychological side of things, and the PT side of things. I've been doing it for a long time. I've been there for 14 years, and I did outpatient orthopedics for 4 years before that. So I kind of want this to be interactive. I have several options depending on how things flow. A lot of times I'll end up going through several exercises with you, but I also want to do some education. And I specifically want to talk to you about muscular pain and just the mechanical features, the biomechanics, the way you hold yourself and the position you're in and all of the things that you do every day and how that affects the muscles and the nerves and the headaches, ultimately. So, have any of you heard of myofascial pain? Does that sound like a familiar word to anybody here? Yeah? Okay. So, myofascial pain is pain that is being generated by dysfunction in the muscles. That it is something that often develops secondary to some other problem. So if somebody has migraines, they might develop myofascial pain kind of as a response to the migraine. But then the myofascial pain can really become its own problem, and frequently does. And it kind of becomes its own pain generator. So we would define myofascial pain by the presence of active trigger points in your muscles. Probably most people have heard of these on some level. Everybody has them on some level. I think everybody's experienced a trigger point at some point in their life. How actually active and painful they can become is pretty surprising for a lot of people. I think sometimes it's hard for people to believe that what they're experiencing might be myofascial pain because it's so intense and it can kind of mimic nerve pain. And I don't think we're used to thinking about muscle pain as being as intense as some other types of pain problems, but it can be every bit as intense, and sometimes it's even the biggest player in a chronic pain problem at some point. So a trigger point is a part of the muscle that is basically in spasm all of the time. That's probably as good a way to describe it as anything. So normally, if my fingers are muscle fibers, normally your muscle should rest in a position where there's some overlap of those fibers so that they have the ability to glide over one another. So when you shorten a muscle, your muscle fibers glide over one another. When you lengthen a muscle, those muscle fibers glide back out. So that ability for those fibers to glide on themselves is how muscles work. It's how they do their job. It's how they support your skeleton. It's how they move your skeleton. It's how they assist with blood flow, assist with all sorts of other kind of internal organ function. But when you have trigger points, what will happen is the muscle, part of the muscle, will shorten and get kind of stuck in this shortened position. We're not really sure how that happens. There are many theories as to how that happens, but we know that it does happen. And there's evidence, you can see it on ultrasound and different tests where the tissue is just more dense and kind of more conglomerate, and then it doesn't move. So when that happens, your muscles don't move normally. They cannot shorten to contract. They cannot lengthen to contract or let other muscles shorten. So they become very dysfunctional, which in and of itself doesn't sound all that horrible, and probably isn't. I think some people have trigger points that they do have those areas that don't move very well, and they kind of function around it and everything's okay. But when the circumstances are right and there are many things that can contribute to that, they become what we call an active trigger point. And that means that they are causing pain all of the time, even at rest. And they have these referral patterns. So they can actually mimic nerve problems, or you can feel pain somewhere else that's coming from the dysfunction in the muscle in another place. So that's the part of myofascial pain that I think not everybody's real familiar with. Most people know if you have a knot, it's kind of stiff and sore if you provoke it or something, but this is more than that.
Okay, that's what I was going to ask. Is it like a knot? Or?
Yeah, it is a knot, and people commonly call them knots. The way we define it is, what most people have experienced is what we call a latent trigger point. And it's just classification of kind of how they are behaving. Okay. So most of the time, a knot, you don't really notice it until someone pushes on it, or you overwork it, or do something to provoke it. But when you have active trigger points, things have changed. And really, I think what has changed, and again, the literature is probably a little bit confusing and a little bit, I don't think it's greatly descriptive a lot of times, but when circumstances are right, and I think it's mostly when your nervous system has been overloaded in addition to the muscles being overloaded, they become active and they hurt all of the time, but they may not hurt where the trigger point is. So particularly with trigger points that refer into the head and cause headache pain, what you really might be feeling is the head pain, but it's coming from a trigger point somewhere else. So they're buggers, and they become this kind of chronic irritant to your nervous system. So what we see is, sometimes it just happens by itself, but often it happens as a result of some other pain problem or some other injury where you kind of tense in response to the pain or the injury. But then they stay there and they become active, and they become another factor of what is irritating your nerves all of the time. And they do it on some level in a way we don't know. On some level that spot itself is causing pain. The other thing they do is when they don't move well, they put a lot of extra pressure on all of the tissues that run through them. So they put extra pressure on blood vessels, they put extra pressure on nerves themselves. Sometimes it's a big nerve that you can really identify. Sometimes it's just the little nerve endings in the area. But that's kind of the belief of why they become part of the pain problem, is they continue to send pain signals to your brain. When you've got some other sort of a pain problem going on, it becomes what we call a wind-up phenomenon, or sensitization of the nervous system. Does that sound familiar to anybody? Has anybody heard that? So when you have chronic pain, what we call it is central sensitization, meaning the whole nervous system gets really wound up, and there's changes in all the receptors and the transmitters that transmit signals to your brain. And so these just become another way to help sensitize the nervous system. And that's what we would call it, is an active trigger point. So what we need to do to treat these is get them to release. Sounds really simple. It's not impossible, but it is difficult when they're bad. And it takes kind of a lot of repetition. It takes a lot of consistency of doing the right things to help release these muscles. But the other thing we really want to pay attention to is what other things, besides the other pain problem, which you might be addressing or might be addressing with medications or something else, what else might be happening that is keeping these trigger points really active? And so the things that overload muscles tend to really make pain problems worse. They make myofascial pain worse. So overuse of a muscle, which can be one big strong contraction, or it can be just little bits of daily activity that build up over time. Anything that overstretches a muscle tends to irritate them. So if you can kind of picture this area that's not moving, trying to get it to move one way or the other provokes it and tends to make it tighten up and hurt more. Other factors that we don't always think about, like getting chilled, but it kind of makes sense if you think about it. When we get chilled, or when we get stressed or tense or emotional, what we have a tendency to do, and it's just kind of an instinctual reaction, is tense our muscles, right? We kind of guard and protect ourselves. All of that type of behavior really tends to make pain problems worse. But you don't do it on purpose, so sometimes it's hard to even identify that you're doing it. But learning how to release the trigger points is really, really helpful. The other part that I will probably spend a little bit of time talking about tonight is alignment, and just how the position your body is in all of the time really affects the amount of strain on your muscles. A lot of times what's overloading things isn't that big strong movement or that big lifting, it's sitting at a desk all day, sitting at a computer all day, driving all day, you know, all the things that we do all of the time. So how your bones are stacked on top of each other, how you're aligned, has a huge impact on how much overall strain is happening in your muscles. So treating myofascial pain involves partly releasing the trigger points and doing it frequently enough and often enough that they start to learn a new normal, which is really what they have to do. You have to, once you've had them for a long time, this is normal to your muscle. It has no idea how to start moving. You really have to teach it. So we have to release it, and then we have to kind of keep doing exercises that help keep it lengthened without overdoing it. So there's kind of a fine line there of how much is okay and how much is too much. And I think that's where people get into trouble a lot of times when they try to work on myofascial pain, is they do too much, too fast, and then they hurt worse, and then they think, oh, I shouldn't do that anymore. But really, what it means is it was too much, and you still want to work on getting those muscles to loosen up and start moving better, but you have to do it at an intensity that is okay. So it's all about modifying the intensity of what you do. You know, knowing what exercises to do, knowing how to release them, but having the awareness to modify the intensity of what you're doing to stay below that level that sets them off. So. Kind of sounds like common sense, but we don't always think about it that way. I think we think if a muscle's tight, we got to stretch the crap out of it. Doesn't really always work. Or if you're out of place, you got to really strengthen all those muscles that are too long. Well, that doesn't always work either. We really need to restore balance, but we need to do it at a pace that is working. I will tell you, as a PT, strength is important. But adding resisted or strengthening exercises to a muscle that is already not moving right and is already completely overloaded is not helpful. And you've probably experienced this. I would imagine most people have experienced this on some level, maybe even in yoga, or trying to do exercises that are meant to be beneficial and they're just making you feel worse. Doesn't mean you shouldn't exercise. It doesn't mean you shouldn't move, because our bodies desperately need to move. We are built to move. Our bodies are made to move. And so many functions besides just muscle function depend on movement. Everything that's going on internally, your bowels, and really largely your blood flow and your nerve flow, your ability to send signals well without getting kind of clogged up or congested or interfered with, depends a lot on movement. So, but just right off the bat, I will say unequivocally, give yourself permission with any movement or exercise you do to let it feel ridiculously easy if it needs to. Setting the pain off does you no good. It does you no good. And might even stop you from doing things that are helpful, and that doesn't help at all. So I have some handouts. I want to go over kind of some of the important trigger points associated with headache. And this is not exhaustive, but these are the really common ones that we tend to find. So, hello.
Thank you.
Yeah, I'll give you each one. Yeah. You bet. Okay. So, yeah. Most people who have a lot of headache trouble, they're all probably going to look semi-familiar. I'm elated if someone comes into my office and they only have one of these referral patterns going on and one of these muscles to work on. It doesn't happen very often. Usually they all kind of become involved. But the one I think that is most deceptive, that people do not think about very often, is this sternocleidomastoid. Because nobody comes to me with a headache problem and says they hurt here. That is not where you feel the pain. It's almost all referred pain. Upper traps, most people, in addition to the headache, probably feel some discomfort or pain in the upper trap region or in the base of the skull. But that sternocleidomastoid is a huge one. It's also a really big player in misaligning our necks. It pulls us out of position a lot. So keeping that muscle lengthened and moving is actually really important. So if you're interested, I would probably like to spend some time going over how to release a trigger point with pressure, because you can. And that's the one tool that you can have with you at all times, that you don't need to go to a doctor or anybody else for, or a PT or a massage therapist. Knowing how to release your own trigger points is really helpful. There are other ways to release trigger points too, but I don't think anything is better than knowing how to release it yourself. So, are you guys interested in learning that? Okay. Okay. Okay, so does anyone kind of know where they have trigger points? Has anyone felt this sternocleidomastoid that runs here, base of the skull, upper trap? I don't know, pick one. Yeah. Yes. Okay. Pick one. But I want to kind of talk you through what to pay attention to when you're releasing a trigger point, because again, you may have heard, oh, you just press on the trigger point until it goes away, and that sounds all fine and good, but there's kind of just some details to know about, some things to pay attention to. I think first and foremost, you have got to be able to stay relaxed while you're doing this. And that's a whole lecture and treatment session in and of itself, is kind of figuring out how to at least breathe in a relaxed way. But we'll use a couple of cues in here to help with it. But keeping your breath relaxed while we're doing this is critical. Releasing tissue involves lengthening tissue, but it also involves relaxing tissue. And both of those components are equally important. In fact, if I had to pick one, I would say relaxing it is even more important than lengthening it. But over time, you want to lengthen it too. So what you want to do is find a trigger point. You want to get some pressure on it. Really what we're doing with pressure is lengthening the tissue just right at that spot. So if I have a rubber band around my fingers, I can lengthen it by doing this, right? And that's kind of what I would call analogous to a stretch. But we can also lengthen it by doing this. And then you can kind of hone in on what you want to lengthen. So you want to get some pressure on a trigger point, enough that you know you're in the right spot, but not so much that you can't keep breathing in a very relaxed way. If it's interfering with your breath at all, it's too much. The hardest, well, there's a lot of tricky parts, let's say that. The other tricky part is when you press on a trigger point, it hurts, right? If you're on one of those trigger points that's causing your pain, it's going to reproduce your pain. That doesn't necessarily mean that you shouldn't do it. It actually means that's a really good trigger point to release. So when you first start doing this, you will feel familiar pain. You should feel familiar pain. That means you're in the right spot. What you need to do is keep that pressure steady and breathe and just give it time. It typically takes at least 90 seconds for a trigger point to release, sometimes even several minutes. So once you get some pressure on it, let your hand do the least amount possible to just stay put. So you're not trying to push harder and harder. You're not trying to chase the pain. You're just staying there and you're just keeping that pressure steady just for the length. And then you just breathe. And it really helps to just bring your attention away from the pain. Just let it do whatever it's going to do. Let the referred pain do whatever weird thing it's going to do, because sometimes it moves around a little bit. And just breathe. Listen to your breath. Maybe imagine that your windpipe that goes down your throat goes all the way down to your belly. And just see if you can kind of feel that pathway. Let your breath move in and out of that long windpipe. And give it time. what will happen if you've got the right amount of pressure is the tenderness under your finger will fade. That pain right there will get less. The referred pain might do some weird things. It might move around a little bit, might go back and forth between feeling a little better and a little worse. So don't let that referred pain throw you. Just breathe, and every few breaths check in with that spot and see what's happening. If it's getting less and less tender, it's releasing. If it's getting more tender, you're pushing too hard and you need to back off. But you just need to stay put until the pain in that spot fades, even if you still feel some of the referred pain. So that's kind of the technique. It does take some practice. I really don't encourage people to go and try to release all of their trigger points all at once, but try one or two here and there and see if you can feel it release. It should have some immediate improvement. The pain should be a little bit lighter, the movement should be a little bit easier as soon as you're done. Does it mean all your pain's going to go away? No, because you probably have about 45 other trigger points in there that we got to release. But you should feel some amount of improvement in the movement or just the intensity level of the pain. So it is a great tool. It works. You just have to make sure you feel the right thing each time you do it. If that pain's getting worse, back off. If you're not breathing, it's probably not fading and getting better. Don't focus on the pain the whole time. Focusing on the pain has a tendency to make us just kind of tense up a little more, so just focus on your breath. Listen to your breath. Feel that long windpipe, or try to imagine what that long windpipe would feel like. It is a good tool. If anyone has ever heard of a Theracane, has anyone ever heard of a Theracane? Do you guys all have them? I know they're proponents here. They usually encourage people to get them. Have you had success with it?
Sometimes.
Sometimes? What about you guys? Have you had success with using it to release trigger points? Okay. Okay. The main thing is make it feel right. Make sure you feel the right thing each time you use it, and then it's great. You can get pretty intense with those Theracanes. You can get some pretty intense pressure, and a lot of times it's just way too much. And sometimes the weight of the cane is enough. If you're really sensitive and your pain is really high, you may barely need to touch that thing to reproduce your pain. And other times you may need to go a little deeper.
We don't even know what it is.
A Theracane? So it is, it's just a little cane. It's like a plastic cane, and it's got little knobs on the end of it. And it's got a few little knobs that come off the side. So it's really made for trigger point release. So it's just got knobs, like the big hook part works great for upper traps. Some of the little small knobs work great for the back of the head and neck. It's just a way to get pressure on spots that are hard to get to on your own. So, okay. Does anyone want to try, well, how much time, where are we on time? Does anyone know the time? Got about half an hour. Are you guys comfortable with trying a trigger point release, or you just want to try it on your own? Okay. Does anyone want to come up here and be an example and see what you can feel? Okay, come on up. So I'll just kind of talk you through it again, because I think the most important thing is just knowing what to feel. All right, so upper traps are pretty good for you?
Yeah.
Yeah? All right, let's come in on this guy. So and just try to stay neutral. Keep your head just kind of in place. I don't know which one to do. Let's try this one. You feel like I'm on it there?
Mm-hmm.
Okay. Is it referring into the head at all?
Not yet.
Not yet? Okay. So let's just stay there. You feel the tenderness where I'm pressing.
Mm-hmm.
Notice how intense it is. And then just bring your focus back to an easy breath. Easy breath meaning your belly is soft enough that it can give a little when you breathe. See if you can imagine that long windpipe. Maybe just listen to the sound of your breath without really doing anything to it or trying to make it bigger. Just see if you can hear that quiet sound it makes. Another trick that works pretty well is you can imagine that part of your breath actually travels into that muscle. Sounds kind of funny, but it works for most people. And then check that spot again and see if the tenderness is better, worse, or same than when I started.
It's better.
It's better, yeah. Feels like it's softening to me. And sometimes it even helps to just remember that what we want from the muscles is for them to lengthen and soften. I mean, just thinking about softening them can go a really long way. It's not so much about pulling on them or beating them up, it's just letting them soften. Maybe check that spot again, see if there's still some tenderness or if it's just pressure.
It's just pressure.
Pressure, okay. So that's what it is. So just move a little bit and see if it moves any easier.
Yeah, definitely.
Okay. So it really isn't, I think, as hard as sometimes we try to make it. Let it be ridiculously easy, okay? Okay. I don't want to spend tons of time on this. I'd love to do it to all of you and just treat all your trigger points, but I don't think we're going to get all that done in an hour. So, but work on it. I do have handouts for that too, actually. I'll just kind of pass them around. It's just a written instruction for what to feel when you release trigger point. Think I got enough? If I didn't, let me know. Okay. Same kind of thing with stretching. You know, stretching a muscle, basically you want the same thing. When the trigger points are really bad, the problem is you go to stretch and you stretch all the tissue around it and the trigger points don't actually go anywhere. So if you can release some trigger points first, stretching becomes much more effective. But the same rules are going to apply for stretching. The big difference is when you're releasing a trigger point, you are on the painful spot, you're going to feel the pain. When you stretch, you don't want to go to pain. There's no reason to stretch into pain. I promise your muscle will just resist. You just want to find, again, some length, even if it feels like a ridiculously easy stretch. And then you got to stay there. And you got to breathe. And you got to let it soften. And it usually happens a little quicker than a trigger point, usually maybe 30 seconds to a minute or somewhere in there. But there's no perfect amount of time. There's no, perfect amount of force. It's going to vary depending on what's going on with you that day and how stubborn that trigger point's being. So give yourself some flexibility to decide how much feels comfortable, and then just hang out there and breathe and make sure you feel it fade. The stretch should kind of just feel like it fades away a little bit. So those are kind of the big basics.
Is stretching
Question?
like short times more consistently or longer times like not as consistent better?
So I would say however many times you do it in a day, the most important thing is that you feel the stretch relax while you're there, first and foremost. So how long or short is going to vary depending on the day. Typically, when we're working on myofascial pain, what we want to do over time is retrain the muscles to have this be normal instead of having this be normal. So that just involves a lot of repetition. The more often you do it, the more likely your muscle is going to lay down length. It's just like when you think about bodybuilders and people that are trying to build muscle bulk-wise. You can't do it once or twice a week and expect to build. Those people they're working them every day or every other day if they're doing it right? Your body has to kind of recognize that it is more efficient to lay down length than it is to stay tight. And that's just a frequency factor. So I usually recommend, minimum of 2 to 3 times a day. Just make sure you do it right each time. And I think it's pretty easy to do. Most of you probably do it anyway. I don't know, I'm watching you in here and you're all kind of like, I do this all the time. I'm always stretching and doing stuff. But you'd be better off to do it twice a day and really feel it release than you are to do it all day and do it too hard and not have it release. Because then all you do is, it feels kind of good for a second, like, oh, it hurts good for a second, and then it doesn't actually let go. Or sometimes you do it too hard and then you take it off and then it hurts more. So that's kind of the basics on treating myofascial pain as far as getting the trigger points to release. So the other part I want to spend a little bit of time on is preventing them from getting mad. And that's where the alignment piece comes in. So there are going to be other things that make them mad, right? I mean, there's going to be times when a migraine gets set off for some other reason, or, you know, there are going to be things you cannot control and you can't change, but you can change the way you're holding yourself every day. It's not easy. Again, because it takes a lot of awareness and a lot of practice, but it can absolutely be done. So alignment, and I kind of hate to use the word posture because I think what looks like good posture is just frequently not good alignment. And I think there are some myths that have been passed down that everybody's been told to fix their posture, like pull your shoulders back. Myth, stop pulling your shoulders back. Pulling your shoulders back does nothing but mess up the mechanics and the relationship between your neck and your shoulders. Tucking your tailbone under or tucking your pelvis, myth. People do that because it looks like it reduces the curve in their lower back, but it does that at the cost of shortening your pelvic floor muscles, shortening your hip flexors, shortening your hamstrings, and a lot of other things. So it may look better, it may look like better posture, but those things are not good alignment. Good alignment is really stacking your skeleton, and I like to think of it like a Jenga game. If you've ever played Jenga, you know, at the beginning, you're pretty stable, you're not going to get out too easily, right? By the end, your game still may be standing, but barely, right? And that's kind of like your body. If you're Jenga, if you're nicely aligned, you're not putting much force on your body just to do everyday things like sit and stand and walk and move around. But by the time, if you're at the end of the Jenga game and you're hanging out there all day, every day, that's just force on all of those pieces that are way out of whack. And none of us have perfect posture. All of us sit too much. Without a doubt, we all sit too much. But I don't know how to get away from that entirely. I mean, I don't tell people they shouldn't stop sitting because, seriously, who's going to stop sitting? But if you can spend a little bit more time standing and walking, that's a good thing, especially walking. But the muscles that tend to really pay the price for that, the muscles that really shorten up over time when we sit, include the backs of our legs, calves, hamstrings, our hip flexors, so the muscles in the fronts of our hips get chronically shortened. Our psoas, which is a hip flexor, also attaches to every vertebrae in your lower back and the bottom rib. So that affects everything that's going on in your spine. And then the backs of our necks, because when we're sitting here, really our heads are in front of our bodies most of the time. And when our heads are in front of our bodies, the back of the neck shortens. That curve gets smaller and crunched and your chin goes forward, and we all do this. So you've probably all heard that really one of the things we want to do to correct alignment for headaches is lengthen the back of the neck. Have you heard that? Lengthen the back of the neck. Lengthen the sides of the neck. Sometimes it's actually easier to think about lengthening the sides of the neck because it removes that instinct to pull your shoulders up. Because sometimes when you just do this, you also do this. And we want the shoulders to stay down. So maybe think about lengthening the sides of your neck and let your chin drop a centimeter. Don't try to do this and stay there all day because you can't. I mean, it's probably uncomfortable anyway. But anytime you think about it, drop your chin a centimeter. Drop your shoulders. Anytime you think about it. But the other thing that's really important to know is it's really hard to just fix that top level of your Jenga game and have all this still be out of whack. It's a whole body process. Alignment is a whole body phenomenon. That's why I think it's great you guys are doing yoga. I think yoga is really helpful for that. And there are a couple of specific exercises that I think are really important that maybe we'll talk about that you can do within yoga or outside of yoga. You can do it different ways. Lengthening the backs of your legs and your calves is critical. It needs to be done several times a day. So we can go over some pretty simple exercises here. You know, I think let's just kind of leave the yoga stuff because you're already doing that. And you probably feel the backs of the legs, I'm sure, when you're doing down dog and all of those things. But lengthening the back of the legs every day is really important. Letting go of this need to stick your ribs out and bring your shoulders back is also really important. We really need length in the spine, not this kind of rib thrusting, pulling the shoulders back position. Again, it looks like you have better posture when you do that, but it's really throwing your spine off. So, lengthening the back of the legs, lengthening the spine, and then the neck or that little chin drop are things that we should probably be doing every day. So everybody pretty much has a yoga mat, right? Okay. So I'll go over a couple of stretches that I would recommend being a part of your daily repertoire. And I have a handout and it's got more on there. I don't think we'll get to all of them by any means, but it's got some options for helping you lengthen what you need to lengthen. The hip flexors are a tricky one. We all need to lengthen our hip flexors too, but letting go of that rib thing actually really helps to lengthen your hip flexors. So anytime you can think about it, drop your chin, drop your ribs. I know this is crash course and it's not all that easy to feel it all at once, but let's go over lengthening the back of the legs and leg alignment, because that's something I think everybody can kind of start with and do pretty comfortably. So I'll have you stand up, take your shoes off, get your yoga mat out. And then I'm going to have everybody stand behind a chair. Let's see. I'm going to just use a blanket. Okay. I'll put them in here so you can see it. So, oh, I'm sorry. Leave your yoga mat rolled up. We're going to just use it to stretch our calves. But as we mentioned before, alignment is a whole body phenomenon. And it starts at your feet. You know, if you're going to restack that game, you're going to start at the bottom, right? So we really want our feet for everyday functional tasks. And there are reasons why you might put your feet in other positions. But for everyday functional tasks, standing, walking, sitting, we want our feet to be facing forward. Most people have a tendency to turn out a little bit. And that is a function of many things, including tight calves, wearing shoes all the time. And I think sometimes people have been told to do that, especially if you've taken ballet as a youngster or something. But we really want to line the feet up so they're facing forward. You visualize that by kind of the outside edge of the foot, or if you draw an imaginary line down the center of your foot, it goes right about the outside of the second toe. So you can either kind of draw that imaginary line down the center of your foot, but sometimes it's easier to just look at the outside edges. We basically want them to be facing front to back. And feet should be about hip width apart. And hip means hip joints, which is kind of where those, what we call our hip bones are at, not hips. I think that's part of the problem. Terminology changes, you know. Someone will say hip and, you know, there's lots of interpretations of that. So hips. And then to stretch the calf, what we want to do is keep that alignment. Bring one foot so that the ball of the foot is on your yoga mat and heel is down. Kind of keeping feet facing forward, keeping your pelvis facing forward. Alignment is one of those things that we just cheat. We just cheat. Our bodies are so good at cheating, and so we think we're going to lengthen our calf, but it's tight, so instead of actually lengthening the calf, we twist our hips, and we do all sorts of things that we don't realize we're doing. But if you can pay attention to how you're aligned while you're doing it, that will help you not cheat. You should feel some stretch in the back of the calf. Does everybody feel that? Mm-hmm. Okay. You might need to look down again too to see if your foot changed as far as which way it's facing. If you're not feeling much stretch or you feel like you could really comfortably use a little bit more stretch, what you want to do is step that other foot forward a little bit. You can even try coming clear in front of your mat. That'll really give you a pretty intense stretch. But the idea is we want to be able to stretch and be aware of maintaining good alignment and just maintaining a relaxed breath. Doing any sort of stretch or exercise to the point where you're tensing up, you're holding your breath, you're hurting, there's no reason to do it. For one, it won't release. And for two, it might end up making you feel worse. So what you want to do is stay there too and breathe and give it a little time until it feels like that stretch, I gotta back off a little bit, eases. It may not entirely fade away, it may not entirely go away, but it should feel like it gets lighter and easier as you hold it. So I would say maybe a minute is a decent ballpark for a stretch, but it's going to vary. And then when you feel like that's kind of let up, we'll step on back and do the other side. Always helps to line up first. And that is something you can kind of pay attention to in yoga, is keeping your feet facing forward. There's several poses where they'll actually cue you to turn them out a little bit, and that's fine. But you can also try it keeping your feet facing forward and see how that feels. Okay. Another little thing I'm going to have you try, just to see if this is a big problem for any of you. You should be able, well, come on out of the stretch and come back to just standing in neutral. Another thing to help you kind of with alignment through your feet and weight bearing through your feet is imagine a triangle under each foot. So there's a point under the ball of the big toe, and a point under the ball of the little toe, and a point under the heel. You really want to stand with your weight fairly evenly divided between those 3 points. Your toes should be touching, but they shouldn't be gripping. If you're finding that you're having to grip with your toes, or your toes are tensing, or feet are tensing when you're standing, I guarantee you're way off. Your Jenga game's way off. You should really have your weight kind of balanced through those triangles on your feet. So a quick check is you should be able to lift and lower your toes and keep your weight essentially in the same place. So that's another little thing to check during yoga, during calf stretching, when you're standing in line at the grocery store, whatever. But most people will feel that it actually kind of shifts their weight back a little bit. You guys feel that? Yeah, so get off your toes, get your weight back. It kind of feels like sticking your butt out. That's okay. We got to get past this thing where we have to keep our butt tucked under all the time. It doesn't help us. Okay, so the next stretch, we're going to do the front of the feet. So same thing, kind of stay aligned. You're going to bring one foot back, straight back behind you, so your toenails are kind of touching the floor. We're going to stretch the front of the foot. Some people really cramp when they start doing this. Most people have never stretched these muscles ever. They get really tight. So again, you might need to look to see what your alignment's doing, but you should still kind of basically be on that triangle. Toes should be liftable. If it's too intense, you can let your knee bend a little bit. If you want more intensity, you can kind of try straightening your knee a little bit. But this should get fronts of toes, the fronts of the ankle and foot, and you might feel it all the way up into the hip. So I'm going to hold that one until it feels like it eases, or if it cramps, stop, take a rest. These ones have a tendency to resist a little because most people have never stretched them. You can also back the intensity off by bringing that foot a little closer to you. And you can make it more intense by going a little farther back. So give that a minute or so and then switch sides. Get lined up. You can always hold on to something for balance. It's better to hold on to something and be able to breathe and relax than be losing your relaxed breath. So, and I have to look on this one especially for me to keep it kind of straight. So let it go. Maybe again check your standing foot. Are you on the triangle? Are your toes liftable? Are your hips facing forward, or have they kind of tried to cheat a little bit for you? Check that. And then when you've been there a minute or so, it feels like it's easing a little bit. Come on back to neutral. So lower legs every day. Stretch them every day. And then another really good one for the backs of the legs. I like this one because you can pretty easily do it throughout your workday. All of these you can kind of do. You don't have to be laying down or in yoga or something to do them. So another way to stretch the backs of the legs, I'm not going to use this at first, but basically you want to get aligned with your feet, same way, check your toes. You want to bend forward and rest your hands on the top of a chair or something like that. And then again, check your feet again, because that may have changed entirely. You still want to stay on those triangles. If you need to bend your knees a little bit to get on the triangles, do that. If you can get straight, get straight. So if you're starting bent, a lot of times just straightening the knees is enough to get you the stretch. If not, what you're going to do is you're going to think about moving your sitting bones backward toward the back wall. You're still kind of keeping your weight back over your triangles, and you're letting your butt stick out a little bit, and you should feel a really nice stretch all the way up and down the backs of the legs. Is everybody feeling that? So I think particularly with hamstrings and backs of legs, we sometimes, well, I think a lot of people just don't know where they attach. They attach at your sitting bone and then down behind the knee. So if you want to lengthen those muscles, don't think about how far you're reaching or how far your back is bending or anything like that. Think about how far away those sitting bones are from your knees. And you don't usually have to go very far if you let that be the movement to feel a pretty good stretch there. And again, you want to be able to breathe. And you want to relax. Good. Are you feeling it? You're just super flexible.
Unfortunately.
I know, sometimes it's a curse. And the other little thing you might want to check, besides kind of are toes liftable, is are your knees actually straight? Especially for those of you that are quite flexible and feeling like you really have to get down there. Could your knees straighten anymore and be comfortable? Something to look at. Sometimes those are some of the little cheats we do that we don't realize we're doing. If you're super flexible and you need more, what you can do, because a couple of you are, is actually do it with the calf stretch. So you get your feet up on a yoga mat or whatever, and then bend, and then just move those sitting bones back, and it'll definitely make sure you're kind of keeping your weight in your heels. So that'll give you a nice stretch. And when you feel like it's kind of eased up, come on out of it. And just see how you feel in standing, kind of getting back into neutral. See if it feels any different. See if it feels easier or just more stable or less pigeon-toed, less awkward. If you feel that at all. Yeah, a lot of what we're doing with our feet and why we're not using them kind of in a front to back motion, which is what we want for walking, is just tightness through the backs of the legs and the feet and ankles in general. So loosening those up every day can be really helpful. You'll probably also find that it's a little easier to lengthen your spine. Once you get these kind of balanced and you get your weight over your triangles, how does it feel to just lengthen your spine? You know, if you imagine a balloon on a string attached to the top back of your head, and just that little lift that that balloon would give you, it should feel pretty easy, and I think you might be able to feel a little more mobility if you get your legs aligned first. So, how's that feeling to everybody? Good? Okay. All right, where are we on time? 10 minutes. Okay, so we can do a couple others. There's a couple other really great alignment stretches that we should probably all be doing every day. This one's going to be laying down. So would someone come demonstrate for me? Okay. Okay. So we're going to lay Yeah, I'm probably going to use both of these if that's okay.
Tell me what I'm doing.
Okay, so go ahead and just sit for a minute. I'm gonna grab one more of these. Kind of long ways so your legs are across the mat. All right. Okay. So, oh.
Tell me I had a prop.
Yeah. So what I'm going to have you do, I'm going to have you laying on it so it's kind of under you like this. Okay? We want the bottom of it to be no lower than the bottom of your shoulder blades.
Okay.
Some people need a little extra head pillow with this. If you need more, I'll bring you a blanket or a towel or something. So I'll do my best to kind of line that up and I'll have you lay down on it. And actually, I'm going to get you something else for your head a little bit. So we're kind of propping the upper body up so that your lower ribs and your lower back can stay really rested on the floor while you do this. And so for some of us, we need a lot of propping. Okay, come on back down. Let's see how that feels. Okay. Okay, good. So we want kind of, again, this is lengthening the lower back especially. We're getting a little bit through the neck as well. But we want that curve between your ribs and your pelvis to kind of start to flatten. It may not flatten all the way, but we want to get kind of close to that. So really the release is we're lengthening all those muscles in the back of the lower back. Can you kind of visualize that as it flattens? Yeah. So it's not about pushing it down. It's not about using muscle force to force them down. It's just relaxing and letting gravity do it. But we'll prop your body up a little bit to make that more comfortable and easier to get there. So I'm going to have everybody try this one. I'll bring you blankets. Yeah. So we may need, not sure how many she brought. If you're okay laying on the floor, you can roll up your yoga mat and use it like the towel. And that works pretty well too. Do that. Well, let's see how quick I can go here. We might have to share. We might have to do a few in stages. So this is actually a psoas release. Psoas. It's P-S-O-A-S. Some people say psoas. I always say psoas. That's just. Oh, okay. Just for your heads? Okay. Let's do that and that. Okay. So depending on how much flexibility you've got here, if your ribs are nowhere near the floor, bend your knees for sure. Sometimes you can get your legs straight and still have enough there, but yeah, I think this needs to come up a little bit for you. Just come up and then I'll get you something else for your head. Yeah, if your ribs are nowhere near the floor, we really need to prop. No, it just means you got a tight psoas. Yeah. So how's that feeling? So try not to use any force to get it there.
Okay.
See if you can just. Yeah, you are a little bit. So we also don't want to tuck. We don't really want to tuck the pelvis to do it. So let's prop you up a little higher. So just put that under your head, and then try bending your knees. And just see how that feels. That looks pretty good. Can you feel it just kind of flatten comfortably? So often when people are doing exercises like this where they're working on flattening that spine, they're using a lot of force and a lot of pelvic tilt to try to get there. This is about releasing what's too tight and what's keeping it there. It's not about forcing it. It's not about moving something else to get it there. We do prop the upper body up a little bit, but that's just because our upper bodies are so tight. Yeah. And that's what we want. We want it to kind of fall into place. I think you might need something under your head too. It looks like you're having to work a little bit to get it down. Can you feel that?
Always gets tight in my lower back.
Yeah. Let's prop you up a little higher. And let's see how high. Let's bring this down a little and give you something under your head. So that it's kind of propping up your shoulders a little bit so that your ribs can kind of just fall. Okay, how's that feeling? Feels good? You feel your lower back just kind of flatten and relax? And that's all it is just laying there and letting it flatten and relax. Okay. Yeah, I've got some handouts too for some of these.
I thought, well, why is she bothering? I feel all comfortable. And I was like, oh.
Yeah.
The difference was a big difference.
Yeah. And the difference is really what's keeping our lower backs tight a lot is just the tension and tightness up top. It's not necessarily that we have to do something down here.
Right.
Yeah. How are you feeling? Can you feel your ribs off the floor a little bit?
I hurt my rib though, so that's why it's kind of hurt.
So are you purposely keeping it off the floor a little bit?
I don't know.
Not necessarily. Try bending your knees and see how that feels. And let's try, where's your yoga mat at?
Right here.
Okay, we got to scoot that up a little bit. So let's bring that up to about there.
Okay. Right
Yeah. How's it feel?
there. Right there.
Okay. You could use even a little more under your head, so I'm going to bend your yoga mat. So come on back down. Let's see if we can get that straight. How does that feel?
That's good.
Good. So again, it's just letting gravity get a hold of your back. And just relaxing. You can also do all sorts of great things with your arms. You can start with your arms kind of out to the side a little bit, palms up, palms down. And then you can start to play with how far away from your body they are and get all sorts of nice stretch through your pecs. You can even go through and do floor angels where you're just going up and down a couple of times. Sometimes it's hard to keep your back relaxed when you do that, so it's kind of up to you, but you can play with all sorts of arm positions and get some nice chest stretch with this too. And breathe. Good. Good, yeah. Just some simple things. There's obviously lots more information, but hopefully that's enough to be helpful and not confusing. I think that's one of the hard parts a lot of times when you think about alignment correction and posture is there's so much information out there and so much overlapping terminology, and sometimes it's just overdone. And there's misinformation. And there's misinformation that's been just taught for ages and ages and ages, and we don't even know why we're doing it. So, okay, a couple other handouts for you. So I'll give you the alignment handout. There's more information on this, but I think we went over the bulk of it. So I know I'm just kind of old school with the paper and the handouts, but it's nice to have something to take home.
I can write. Thank you.
Yeah, sure. Yes. I can never quite find the pictures I want, so I end up drawing stick figures. I'll set these on the chairs. Okay, so we're good. So you guys are ready for yoga now.
I know, I thought maybe we